Welcome to the Happy Bones, Happy Life podcast. I'm Margie Bissinger, a physical therapist and integrative health coach, and I am your host and guide on our journey to discover the keys to stronger bones, more happiness, and the secrets to live your best life ever. From nutrition to stress, from exercise to happiness, you will gain revolutionary insights from our leading experts. It is time for you to discover the health and happiness you deserve. Hey, Margie here. Today, we're focusing on CBD and how we can use CBD oil to improve our sleep, our stress, and our bones. And we have a very special guest, Dr. Mary Clifton. And Dr. Mary is a board-certified physician practicing in Manhattan. She's a recognized expert in CBD and cannabis and the host of the CBD Health Revolution and highly respected professional certification course, the Cannabinoid Protocol. She has worked with several pharmaceuticals, CBD and cannabis corporations on product development and has provided medical and scientific directorship in the United States, Europe, and Africa. And Dr. Mary is an internist, so she brings this background and all of her expertise, and she's worked with bones as well, people with osteoporosis for so many years. So I'm really excited to have her here. And in today's talk, we really discuss CBD and how it can help these conditions and how you can put it into your life and use it, as well as how to know if it's safe, what's not safe. So she really clarifies so much of this for us. So stay tuned. Welcome, Dr. Mary. I am so thrilled to have you here. It's really such a pleasure. I've known you for a while, and we've been on a program together on osteoporosis and done other things, but I'm really excited to have you here on this topic because it's something that people really want to know about. So welcome.
Thank you for inviting me back.
And it's interesting, in a world where 80 million people are now Googling CBD and cannabis. How did you get into this? Because it's such a topic now, and people are fascinated with it because a lot of people are really being helped. But how did your career path that you got so involved?
Yeah, if you look over the span of my career, I've always been interested over the past 25 years in patient empowerment and trying to put the capacity to heal yourself back to the patient. I felt like so often as I ran my office space that, people were relying on me to control their diabetes and their depression. And in a lot of cases, people do need some assistance, but a lot of the products that I provided were things that had significant side effects, or if patients felt good on a day and didn't necessarily feel as anxious or depressed, they still had to take their medications. Otherwise they had, significant side effects, dizziness and headache and things. So I never felt really satisfied with some of those treatments. And I've just been listening to patients and trying to find what works. I spent many years in a vegan diet and in helping people adopt healthy diets, and then spent many years after that, and then started to think about cannabis. I have a long history of just working in these patient empowerment areas where I think people can, take back the control of their health and get excellent results from their conditions and by empowering themselves. And so following a healthy diet, getting regular exercise is such a critical part to having a successful aging process. And then the CBD and cannabis work so well for many common conditions that I wasn't getting good control with the current Western model, like anxiety and stress and sleep, and some pain syndromes become very difficult to treat if you're choosing not to use cannabinoid formulations.
That's great. So let's start from the beginning because people are really, really confused. And it was interesting. I have now children living with me because of the current situation. And so my future son-in-law has said, oh, CBD's, I told him I was interviewing someone on CBD. He said, oh, that's everywhere. Every sports place, every cream, that's total hogwash because it's now. So explain exactly what CBD is and how do we
really ascertain the quality, because I think as he said, it's true. There's CBD in creams, there's CBD in everything. So how do people really know what they're getting? And maybe you can give us some clarity on this so that we can utilize this incredibly beneficial compound and use it to help us instead of not knowing and just being so confused on
Oh,
what to do.
absolutely. I mean, CBD definitely is a very powerful product. I mean, there's, 6 studies, 5 very good studies looking at managing seizure in people who have drug-resistant seizure disorders. So I feel like if a product is strong enough to help people have seizures, it may have some benefit in other places as well. So it definitely has some medicinal value, I would argue. But I think that that all of the CBD pillowcases and CBD infused everything has thrown everybody off a little bit. But if you think about the hemp plant, and you're trying to get the medicinal benefits from a hemp plant, and hemp is just another type of a cannabis plant, but marijuana plants grow to concentrate THC, the component of the cannabinoid that gets you high, and the hemp plant concentrates more CBD. But there's actually 70 different cannabinoids in a typical hemp plant. So you have THC, the product that gets you high, in really high concentrations in some plants and in really low concentrations in other plants. And then CBD, the other predominant cannabinoid. But there's also CBN, CBG, CBC. There's 70 up to potentially 100 if you pick apart the molecular structures well, of all of these different cannabinoids that work for people. So if you basically take some hemp flowers and put them through one distillation, just basically squeeze out the oils that you get from that will give you your full spectrum CBD. So it has CBD in it. It may also have a trace of THC, some CBN, CBG, all of the phytonutrients that you find in a whole plant. And so it's one step down from simply just, consuming the hemp plant directly. And then if you just want the CBD, if you want to get rid of all of those other things and sort of think about it like taking a vitamin C tablet instead of eating an orange. So if you're using a full spectrum product, but you just want to get the CBD out of it, you can run it through a second distillation, and then you have just the pure CBD isolate. And some people prefer a very pure product with just CBD. A lot of people tend to use a full spectrum product because they believe that eating orange is better than eating a vitamin C tablet, and that you get benefit potentially from what's referred to as the entourage effect, where all of the other cannabinoids and the terpenes and the phytonutrients that you find in a more whole plant are going to come together and work synergistically.
And what's been your experience? Have you seen, let's start with sleep, for example. That's such an issue, and there's been good research how
huge.
CBD can help sleep. Have you found that it matters if you have just the isolate or if you have more of the whole plant?
Well, sleep is really interesting. CBD has been used to study sleep quite a bit, and a lot of the trials have been like dosing tool trials where people input data on what they're using to fall asleep and then give you data on how well it's working. So we have quite a bit of data from those types of tools that are like applications you can put on your phone. But we also have a very well done study in Canada that involved about 100 people who had very serious PTSD and had a lot of intrusive nightmares, like up to 5 a week. And most of these patients were only sleeping 5 hours a night because of the intensity of the anxiety and PTSD. And they ended up with that, with taking a cannabinoid formulation, going up to 7 hours per night of sleep, and reducing the frequency of the nightmares down to 1 a week. So it was a setting of managing sleep that had quite a bit of anxiety overlay. But with both of those pieces of information together, it's very reassuring that if you have some sleep trouble, you can get benefit. So there's benefit from CBD. There's probably also some benefit from THC used in combination, and even the very tiny amount, like the 3 parts per 1,000 in a full spectrum CBD would probably help. But there's also some studies on CBN, looking specifically at CBN in rat models, where they found that rats given a very pure CBN were found to have quite a bit of sedation and lethargy, and just had a hard time not falling asleep. And so there's a lot of studies, especially concentrated, Margie, in Israel, where they're looking at individual cannabinoids and trying to figure out which ones are having what particular effect. And the most innovative companies are just going forward and creating CBN infused CBDs, or CBG infused CBDs, if you're trying to take advantage of the muscle relaxation and the immune benefits. And so those are some very exciting products that are coming available now.
So if someone's listening and they are having issues with sleep, because a lot of people do, and they're wondering, is this safe? How is this working? And where would they start? Like, is there a certain dose? Could you give them maybe some information on how to begin, and really reassure them on the safety? Because, it can be a little scary when you've never tried something.
It's very safe. I mean, the very exciting thing about the endocannabinoid system is that it's so new and so innovative, but yet it's ancient. We have documentation from ancient medical literature of people using these products. I mean, going way, way back 4,000 years. So that's exciting that a lot of people have used these products for many years before the prohibition. As recently as the 1920s, there's information medical textbooks where it was suggested that you use some cannabis to manage migraine headache. It's really, really interesting to see that and read that, and see how things have changed over 100 years, and now we're full circle again. This endocannabinoid system was really only identified in the 1980s, and we find these CB receptors, the cannabinoid receptors, all over your body. They're in your brain and spinal cord, but they're all throughout all of the organs in your body too. And they are stimulated by natural CBD that your body makes. The naturally occurring CBD in your body is called anandamide. And if we, for example, biopsy an area of colon that is diseased or inflamed and stain it for CB receptors, you'll find a higher concentration of CB receptors in that area of the colon. Or if you have like, for example, a swollen knee, like a rheumatoid knee, and you take that fluid off, you can find that there's a higher concentration of anandamide in that fluid. So the body is already utilizing the endocannabinoid system to restore balance and homeostasis, and adding additional CBD just works with that system to help everything continue to stay really balanced and stable.
That's great, because I know when you're looking at CBD, there's such a difference in price point. So where would you say someone should start with concentration? Would you start at the lowest dose and move up, or how do you typically?
Oh, I think that's a good idea. I always suggest you start low and then build up slowly. A lot of people, it's very, very safe, although it's probably not super beneficial to try 20 milligrams. But a lot of people start there and then build their confidence and then go up from there. The interesting thing about these CB receptors is that there are no receptors in the brainstem. So you can literally just never have a problem with an overdose circumstance where you slow down your heart or you can't breathe because you've taken too much CBD. I mean, I suppose if you drank a truckload of CBD, you could die from fluid overload, but you're not going to die from the CBD.
Wow, that's great. And when do you recommend taking it? Let's say on the sleep for a minute. What time of day? How soon before bed? Or what would be your recommendation? Someone's listening and they say, I haven't been sleeping. I want to try this. It's safe, and it's something that could certainly help me. So
It's been really hard to sleep. A lot of people are
yes.
describing recently dreams of bugs and worms and some really scary dreams. So it's important to try to get your sleep so that you can still be productive and beneficial to everybody you love. I think taking the product, a half an hour before you're ready for bed, if you're using a tincture, which is a great place to start because you get a nice rapid onset of action, you can hold it under your tongue or in your cheek for a minute, and that will help with most of the absorption to happen virtually immediately within 8 or 9 minutes. You'll have your result. And then if you're not getting a good result after 10 minutes, you can go ahead and take a little bit more, and it'll help you to figure out where you need to settle out. Some people need 60 or 100 milligrams. A lot of people do okay with 20 or 40. So it just depends. It's very individualized. It depends on the number of CB receptors in your body that's genetically determined. And it also depends on the amount of enzyme you have that breaks down the CBD. So people end up, having different responses to different levels of administration. So you just have to go with it and see what works for you. It generally takes a week or two to really get to the bottom of exactly how you like it in your body and how it works for you.
And do you find most people, the first time they take it, will experience a difference?
Maybe the first time. I find some people who are really anxious about the safety, it will take 2 or 3 drops and say, I haven't really noticed a difference. And it's hard for 2 or 3 drops to have an effect, really. I mean, that's such an utterly small dose, even with the most concentrated of products. So, working on increasing as comfortably as you can to as quickly as you can to something that's a little more effective is a good idea for most people. I've had people tell me like that stuff doesn't work, and then I say, well, how did you try it? Well, I used it once. I gave it to my dog once. It doesn't work. Well, maybe you should try changing the dose or changing the time, or did you try but at that point, that's not a good trial. One dose for you and your dog is probably not a good trial.
Wow. What about in the middle of the night? So there's so many people who go to sleep and then they wake up in the middle of the night and they're wired and there's so much on their mind. So they could just have it near their bed, right? And then,
Yeah. 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 I was actually dealing with a patient last night, sort of out of schedule. Whoops, sorry about that. Tipped my table around because I've been meeting with him every week to help him work on getting his psychiatric medications balanced and many of them discontinued in favor of fewer side effects and better control with CBD. So this has been a really fun project. But he messaged me yesterday saying he's just so sluggish all day long and feels like he's just dragging a bit through his day. And we have made some recent modifications to where, it could be just the medication withdrawal. But then I mentioned to him, why don't you try taking your product at nighttime at the highest dose? Because there is, benefit to just getting that sedation response when you're about to go to sleep instead of trying to take it in the morning. So anyway, almost immediately a really nice benefit to taking the product at night instead of in the morning. He feels a lot better and alert during the day. There's quite a bit of sedation with some people with taking it. So, and that will often go through the whole night. So a lot of times that middle of the night awakening, that secondary insomnia where your thoughts are running and you can't fall back asleep, that might be a good time I mean, you might find that isn't happening for as long or as frequently just with dosing before bed. But there's nothing wrong with taking a little more in the middle of the night too.
yeah, I've taken it and to me, it's amazing because when the whole COVID thing happened, my husband's a doctor and my brother was on the front lines. So just a lot of people. I had good friends' mothers who were
Worry
on,
about.
just a lot of things. And even though I meditate and do everything, I was still waking up in the middle of the night. And so I said, right before bed. And it was really quite wonderful. So I personally have used CBD for numerous things. But for everybody listening also, sleep is just so unbelievably critical for every aspect of your body. For your bones, you need the sleep. For good weight, for, right, Dr. Mary, every single thing to be healthy, you need your sleep. So it's really one of the fundamental principles of staying healthy. So the fact that this can help, I think, is huge.
There is really nothing that beats a great night's sleep for managing your health. I used to think it was all diet and exercise, and that all of the other things, the sleep and relationships and spirituality, were very secondary to diet and exercise. But sleep is such a critical part of everything. And the great work that everybody is doing around sleep within our community, there's so many opportunities for people who are having trouble sleeping to get into a program and to work on their sleep with so many experts in our community. But a lot of the data around particularly managing Parkinson's disease and 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 anxiety and a lot of the diseases that have a little bit less uh, um, you know larger research trials, when we're relying on just case reports for a few case reports on how it might be helping, we think that it's helping a lot in sleep management, rather than actually helping the disease itself. Like the very best studies that are done in Parkinson's really show that Parkinson's patients on CBD still have the same amount of tremors. It doesn't really appear to help reduce the tremors consistently. It does for some people, but it doesn't consistently. But what it does do is put these people to sleep, and so that they get a great night's sleep. They don't get some of the night terrors associated with Parkinson's. Parkinson's patients sometimes have very vivid nightmares where they strike out in their sleep or kick in their sleep, and they've actually injured their bed partners frequently. And small but very robust studies have shown that those types of dreams are reduced or even completely eliminated when Parkinson patients are treated with CBD. And so even though their tremor is still present and irritating, they don't have this background chronic insomnia and horrible nightmares that just makes everything so much worse.
Wow, that's so very interesting. Let's go now. You just mentioned it, anxiety, because that's another thing right now. First of all, regardless of this, I know with the people I work with, it's a problem. Stress and anxiety are just very, very high, and especially now during this time with everybody's going through, it's really been skyrocketing. So why don't you explain how it really helps anxiety?
Oh, with anxiety, there's some great studies, but my favorite study on anxiety was around a small group of young men, college-age men who had generalized anxiety disorder and social anxiety disorder to the point that they weren't even going to class, much less going and having all the social experiences that make college so phenomenal and fun. And so they took these gentlemen in and did a couple of terribly anxiety provoking things. They gave everybody an MRI, and before the MRI you had to have an IV. So they took half of the group, treated them with CBD, and left the other half of the group untreated. And at every point in the test, at 30, 60, 90, 120 minutes, the people who were pre-treated with CBD had lower anxiety scores, and they were able to tolerate the IV and the MRI much better. But then on top of that, the MRI also was a functional MRI. So it showed the areas of the brain that were lighting up in response to the MRI. So they were also able to show that people that were treated with CBD had a different response, a different way that their brain lit up that was more normal, if you will, and less like consistent with anxiety out of control. So really a smart, well done study, even though it was small, only 10 people. It gives us some really great information about how CBD works in anxiety. And there's a whole bunch of other studies too that just provide additional support and make you feel really secure about managing anxiety with these products.
And what have you seen in your clinical practice? Because how much better is that than taking a prescription medication for anxiety when you can take the CBD? But what have you seen with the patients that you've worked with?
I think it's so much better because, so often patients don't necessarily want to take a prescription every day. Some people get really anxious on Sunday night and Monday, and, because the work is so preloaded during the week. And then by Thursday, Friday, Saturday, things are pretty calm and they may not really even need their antidepressant. Or, when something happens and you need help, urgently, it's such a great way to be in control of managing your own anxiety and depression because we've shown study after study that the more control you give a patient, then the less medication they end up using in the long run. If you can take it when you feel you need it and you're in control, then it just makes it so much easier to take what you need and ride it out. So it's a really good idea to have a product that is okay to skip, where if you skip a dose, you're not gonna, we're not allowed to say dosing. The FDA what requires that we do not use the word dosing. So when you administer an amount, you should be, you should be able to be in control of that and skip a day if you want to. I love that about CBD, but I also love that if you're like immediately anxious about something that is coming at you in a wave. And I have to say there's a lot of COVID moments right now where a lot of anxiety seems to wash over me and also the people I love. So having something that can manage that wave of anxiety really effectively without making me addicted or turning me into a zombie for the rest of the day, that's a very good thing to have on board too.
Oh, absolutely. That's what's so nice. You can use your tools, your meditation, your breathing and all the things, but it's there. It's there to help and it's not going to have the side effects and you're not going to feel that now you have to be on a certain prescription medication that you can't stop. So I think it sounds like a real win-win situation and something that's available to everybody. So let's go to bones now. So we know that sleep, all the things we talked about so far, sleep significantly improves bone health as well as anxiety. There's been studies showing relationship between bone density and anxiety. And people don't realize that, when people,
Yeah.
I'm sure, because you worked with osteoporosis for a long time, people are so worried about what they're eating. Are they doing the right exercises? But they don't realize that the anxiety itself is a risk factor. So I think just even if that's all CBD did was the anxiety and the stress, it's going to have a huge effect. But are there other areas that you see with inflammation or whatever that's going to help bone health?
Well, I think you're right on. That was exactly the next thing I was going to say. We have to think about inflammation too. And CBD is so fascinating around inflammation. A great rat model study looked at CBD given before an episode of the flu. They took half of a population of rats and pre-treated them with CBD, and then gave the entire cage the rat flu. And the rats who were previously treated with CBD had reductions in their immune response, in these like wild immune responses where you're just feverish and aching and sick in bed. All of those cytokines that get produced that create that, the interleukins and tumor necrosis factor, those cytokines were reduced by as much as 80% in the rats who were pre-treated with CBD. And they were, in fact, still able to eat and still able to drink a little water and even do some memory mazes. They felt good enough to do that. But rats who were not pre-treated actually did not, obviously didn't do as well. And so there's and there's human data on modulation of the immune response with CBD, because that chronic inflammation is damaging to all of your systems, but certainly, of course, also to your bones. And
Wow,
so,
so interesting. You wonder right now, because that's been an issue with the cytokine storm and the COVID-19.
oh,
So has
absolutely.
anyone tried it? If people are, even with younger people, that's been an issue. Has that been something it's so recent, the COVID, so I guess they can't. Has anyone ever
Yeah, I
looked
don't
at
think
that at
that
all?
we have any research where we've put
Yeah.
5,000 people on CBD and followed them, but it might be fun to go backwards in some of the charting and just see if the level of inflammation is different for different people. That's an interesting project. And so,
Yeah.
because there is some data that CBD can modulate your response to West Nile virus and influenza and hepatitis. So that immune modulation and it just it really suggests that this is a beautiful sacred plant that was given to us to help us feel better. I don't think that we're here to be in pain and be suffering and anxious and really miserable during our time on earth. I mean, and the fact that we have an endocannabinoid system and cannabis that grows like a weed in the ditch, if you leave it alone, it's so easy to grow, just suggests to me that maybe this whole thing was put together so that we could have like a calmer, happier, less painful experience while we're here.
And it's interesting because, right, inflammation has a huge effect on our bone health. But as a physical therapist, I've seen major improvements because way back we didn't use, it was something that wasn't even available. But now when people have back pain, all sorts of pain, it's just, I've seen so effective. It was interesting because the pool man who came, he was getting a total hip replacement. This is
Uh-huh.
2 years ago. And he couldn't walk. And he's like, oh, is there anything that you know? And I said, you know what? The people that have the best results with CBD. And I told him what to get and different things. Next time he comes in, and it was pool season. This is before COVID. So he couldn't have, he couldn't stop working to have this hip replacement. He's walking. He's like, Margie, that CBD was amazing. But then it was interesting. Then he did a different brand. He just bought something and it didn't work. So maybe you could speak to that also. But anyway, he eventually had the total hip, but it was amazing for someone who couldn't walk. And then all of a sudden, and I see that with patients with back pain, with so many different acute issues that really are, and when you have pain in your life, it really reduces your happiness. So we want to try to
There
minimize
is
pain.
such there's so many good points in that commentary that, it's important to get the right product because you literally can get a CBD infused pillowcase. And I don't think that's going to give you a lot of benefit for helping you sleep, but you can find, some great CBD products. And if you can handle the THC and the other products within that, if you're comfortable with all those things, then a broad spectrum CBD is probably preferred in most cases. But if you don't want to have anything but CBD, you can use an isolate. And then I think it's very important to buy from somebody so that you not only benefit, that person benefits from your purchase, you also benefit from the fact that they reviewed the product and understand the quality of the product. Because there's a lot of people making CBD today. You should expect that your CBD producer is doing third-party testing on every batch. They have to third-party test to make sure that their CBD and THC concentrations are appropriate. And some people just stop there. But really good companies are going to test for heavy metals and insecticides and pesticides and give you very robust data on the CBD. And the thing is, we were talking last night at the Cannabis Business Association happy hour meeting about like who should be managing CBD, and is it really should it really fall under the FDA? And it really shouldn't, because there's so many different potentially active compounds in a broad spectrum, hemp product. You're looking at potentially 150 different chemicals in that bottle that could be working together to help you. The FDA has no idea what to do with that. They want like one molecule or maybe two molecules, in a pill. They don't want anything more than that. So I don't know. The FDA just isn't equipped to handle it, I don't think. But then the USDA, if the USDA manages it, my word, I would love to have seed to sale transparency for everything I put in my mouth. You know, I'd love it if that was true of my potatoes and my carrots. And because I don't know the growing standards, and I don't know the insecticide and pesticide concentrations in these products. You know, I mean, the people within this industry that hold themselves to that really high standard should be rewarded for that. That's an important thing to share.
Yeah, that really is that's great information. And then why don't you tell us, because I know there's certain products that you really prefer and companies that you've been involved with, or that, you know, that's what you personally recommend to your patients.
Yeah.
How did you choose that, and what makes that better, you know?
I look for companies that are doing organic growing practices and that also at every level are honoring the workers, because making sure that workers are properly reimbursed and handled is important. The insecticides and pesticides, the heavy metal concentrations that we already talked about, and then innovation in the products. You know, we talked about the Nuvita product line, and you were potentially going to share that. We got a really great discount code set up and everything. The thing I love about that company, Nuvita, is that they have both a CBD isolate line and a broad spectrum line, and they also have CBN and CBG infused CBDs. So you can get really great products, and their prices are very competitive.
Is there anything else that you wanted that we left out that you think is important for people to know?
Well, you know, we talked about safety, but it's also legal in all 50 states. It's protected, you know, the hemp is protected under the Farm Bill, signed in 2015 and 2018. So a very safe and protected situation to use CBD. So it's not going to be an issue with, impacting legality or putting you at any risk with any local law enforcement. So you don't have anything to worry about there. And again, just very safe.
This has been just so wonderful. I always love talking with you, and you're always so full of important information to help people. And you always, I think that's what I love so much, is that you don't just stop. You're always on the cutting edge, and you're always looking to what's helping people and how you can help the people that you work with. So thank you for all the work you do and bringing that to us. And I hope that it will help our listeners, and I'll have all the information that we talked about in the show notes and ways that you can learn about these products. And so if people want to keep in touch with you, Dr. Mary, what's the best?
Go to cbdandcannabisinfo.com. That's where I house all of my videos, and any email that you put through there is going to come directly to my inbox. So I'll be able to respond to you and get things taken care of very quickly for you.
Oh, that's so great. Well, I can't thank you enough. It's always such a pleasure, and look forward to keeping in touch.
I hope you've enjoyed today's interview with Dr. Mary as much as I have, and now have a better understanding of CBD, how you can use it to improve sleep, reduce stress, reduce inflammation, and then in turn help your bones. So all the links that we talked about will be in the show notes, as well as Dr. Mary's website and information. So goodbye for now, and look forward to seeing you on the next episode. Thank you for listening to this episode of the Happy Bones, Happy Life podcast. If you enjoyed this show, please subscribe on your favorite listening app so that you don't miss any amazing insights on upcoming episodes. And until next time, continue to live your best life ever. See you soon.